Welcome back, everyone. Next up, we have HueDx. It's a technology platform for developing and launching rapid, quantitative, assay-based RQA diagnostic tests in a fraction of the industry standard time. Quantitative, on-demand, low-cost diagnostic results specifically tailored to your need are produced in seconds using a mobile phone camera and a Hue card. No lab, expensive equipment, or complicated sample collection necessary. Hue cards can be developed for partners in the medical, agricultural, industrial, veterinary industries, and more. Develop your own assay or choose from ready-made HueDx assays to launch your configuration of a Hue card as a complementary or mission-critical product in months and not years at a fraction of the cost. Pleased to introduce the CTO, Sam Parks. Welcome, Sam.
Thanks, Anna. Hi, everyone. My name is Sam Parks. I'm the CTO at HueDx. Like Anna said, we are a rapid test development and launch platform. And the opportunity that we're focused on here is sort of born out of the fact that since 2020, 3 billion assay-based tests have been performed. We're all familiar with assay-based tests. They're everything from pregnancy tests, COVID tests, rapid medical diagnostics, also things in testing industrial materials, things in the agricultural industry, soil nitrogen assays, water quality assays. We're all very familiar with these. They're used all over the place globally. They're very accessible, they're very fast, they're very inexpensive. 99% of those, however, are non-quantitative, meaning they don't give you a number, they give you a yes or a no, or they're quantitative, but they require a lab or a technician or expensive equipment, making them far less accessible and synonymous in today's industry. 1% of them are actually quantitative. They're inexpensive. They don't require a lab. They don't require a technician, and they don't require expensive equipment. Capturing just 4% of those tests used since 2020 equates to about a $5.6 billion revenue opportunity in sales tests. In the sale of those tests alone. That's not including all the other verticals and opportunities that you have along with that data. We call these kinds of tests, those 1% of the 3 billion, RQAs, rapid quantitative assay-based tests. So you may be asking, why is the distribution so dramatic like that? And it's because RQAs are incredibly difficult and expensive to develop and launch. So most people don't, frankly. While they are difficult, they are the future of diagnostics, and they open many doors across many different verticals. However, they take, and this is an industry standard, this doesn't matter. It doesn't matter whether you're a startup or you're Pfizer. Your go-to-market time is 2.5 to 6 years. The cost to develop is 4 to 10 million. And without exaggeration, for big pharma, you can add a zero to those numbers. It's 40 to $100 million in 2 to 6 years to go from identifying an opportunity to actually launching a product, launching an RQA. And that's a problem. That's why the distribution is the way that it is. So why are they so difficult and expensive to develop? Well, the industry standard, no matter who you are, big or small, you have to go through these steps. You have to develop the chemical assay itself. You have to develop the physical device. You have to develop an image processing pipeline, photo ingestion, machine vision tools, machine learning model development and deployment, and then all the other software frills, user servicing, backend APIs, just to service that test and ensure that it's truly an RQA and not something like a pH strip that you read off with your eyes. That alone is 2 to 4.5 years. Then on top of that, if you need regulatory approval, like with the FDA, if you're making a medical RQA, that's another 6 to 18 months, and you're looking at 2.5 to 6 years. By then, the opportunity has passed you. You're better off making something that's non-quantitative, and really leaving quite a lot of money at the door. So what we have done is we've replaced that entire process. We take a 2 to 4.5 year process, we turn it into 3 to 6 months. And if the FDA isn't applicable for you, you're launching a product in 3 to 6 months. You're going from identifying an opportunity to selling a device in 3 to 6 months, as opposed to 2 to 4.5 years. That makes launching something like this accessible to companies that would never have even considered launching an RQA or a product like that before. And we can do that because we are an RQA development and launch platform. We eliminate the need for you to develop assays. We eliminate the need for you to develop a physical device and all the software. And we simply launch a branded product for you. If you can create a colorimetric changing visually indicated assay, something like a pregnancy test or a COVID test, and drop it into our what we call the Hue card. You can have 6 independent, unique assays on a single Hue card. You drop it in, we manufacture these in volume, you upload a photo of this card to our cloud, and you have results in seconds. It's actually that easy. We cut out all of the risk, all the cost, and all the time. So a single photo, and you now have quantitative results, lab quality quantitative results with a single photo. And this is truly sort of a drag and drop solution for companies that would never consider this to make medical diagnostics, diagnostics, agricultural assays, and everything in between. So we take a process that originally would have been 2.5 to 6 years. We turn it into 9 to 18 months, including regulatory approvals. We take what would have been $4 to $10 million in development cost, and we turn that into a very deterministic, very low risk, $500,000 to $1 million. And we take a break-even point across the board. The average break-even point for companies that develop true RQAs is 2 to 5 years. That's on top of the 2 to 6 that it took you to develop the test itself. So you're looking at a 10-year time horizon to be made whole from this sort of a venture. That's why the distribution is 99% to 1. We turn that into 3 to 6 months. And one thing that we want to be abundantly clear is making these tests so accessible means there are companies, nutrition companies, agricultural consultants who would never consider actually designing and launching a product like this because it's out of their wheelhouse. If you've never developed an assay before, you have to spin up all these resources. So what we can do is we have 3 prongs. We have a 3-prong approach here. Option 1, you can actually develop your own assay with our tools. We offer a plethora of software tools to help you develop them yourself in a few months. And we're talking going from 100 to 100 or 200 experiments down to single-digit experiments to arrive at an assay that you can launch as a product. Or option 2, you can select from an array of existing assays that HueDx already has that we've developed over the years. Or option 3, you can tell us what kind of assay you would like. Maybe you want to measure gut health or fertility for maybe a nutrition company or a sort of data-centric health company. You identify it for us. We develop that over the course of 1 or 2 months. We drop it into a card, a Hue card. We brand it as your own, and you launch it as your product, as a complementary product to your existing offering. To give you an idea of just how fast we are and how effective this platform is, this is an example of just our medical diagnostic pipeline. This is not including the agricultural, the industrial, the food processing, etc. pipelines. This is just for medical diagnostics. So we have everything from liver function, kidney function, metabolic panels, infectious disease, fertility screens, cardiac screens, cancer screening assays, and far more. And to give you an idea of just how fast this is moving, you'll notice up at the top the liver and kidney function tests. That's 8 total tests. We actually began those in the sort of identified opportunity and planned R&D in December, so roughly 3 months ago, and we're preparing for FDA trials. So this is purely a open up the floodgates and sort of let it happen and get out of our way type of thing, because we can really, really push these things out. And normally, industry standard, you would expect for these 8 tests to take, between all 8 of them, you're looking at 3, 4, 5, 6 years and a few $1 million. So it's really made accessible for us. To give you an example, that liver test that I mentioned at the top, those 6 tests, this is an actual photo of a Hue card. And you're looking at 6 different, really unique looking colorimetric assays. So finger stick blood was applied to the back of this card. It transfers through our microfluidic paper matrix that's in the Hue card, and you get a color change. You take a photo of that, it goes to our cloud, and you get these quantitative results in seconds. It's very, very easy, very, very fast. And I know I've been alluding several times to the applicability of this technology across industries. And it really is. We have the ability to drop in assays that can measure things in many different industries, not just in medicine. Everything from in the medical field, blood panels, urine tests, I mentioned gut health, cancer screens, but also in agriculture, things like soil assays, where normally across these industries, if you want the kind of results that we can produce in a quantitative, high quality, precise and accurate way, you're having to take these kinds of samples across these industries and send them to a lab. That's your alternative. Your alternative to HueDx is collecting samples, sending them to a lab, paying usually pretty exorbitant rates, and waiting to receive those results. So imagine just transferring the responsibility of collecting all these samples and sending them to labs onto a Hue card, where you have results in seconds. It costs single-digit dollars, and you can manufacture these things in bulk and sell them across an array of industries. The opportunity is enormous. So we've also sort of got our ducks in a row as far as intellectual property strategy. It's very forward-looking. We have 8 granted patents. We have 3 pending, 9 trademarks, and we intend to file 5 more patents in 2023. These are we have an IP presence all across North America, Europe, Asia, the Middle East. And sort of the strategic pillars of how we have approached this over the last few years and how we intend to approach it in 2023 is we want to cover everything from overall utility to how the device is designed, how we make the devices, how we make the assays themselves, and even the algorithms that we use for measuring the devices, all the software in the cloud. So we have a very holistic, forward-looking stance for our intellectual property, which complements very well what we intend on doing this year. So this year alone, in the first quarter, we launched our flagship products, the Hue Card and the Hue Cloud. We closed our first enterprise platform contracts just 30 days after announcing this product. We've already closing our first contracts. We filed several patents, and we also closed an oversubscribed follow-on investment round just a couple weeks ago, as we prepare for the second quarter, where we'll be announcing another round, an additional fundraising round that will include a crowdfunding campaign, actually. So you'll hear from me and our team shortly after this presentation. Please reach out to us if you'd like to know more about this round, but we'll be opening that shortly. And we'll be using those proceeds for the rest of what you see here for 2023. We have a lot to do. We'll be finalizing FDA submission data for several of those medical tests. We expect by the end of the year, we'll be receiving approvals for those tests. We have 3 or 4 more enterprise contracts that we expect to close in Q2 alone. We'll also be standing up enterprise sales operations and quite a bit more for the rest of 2023. So there's a lot slated for this year. Fundraising has been wildly successful. We've been oversubscribed. Our technology is done and ready. We're selling it now. We're closing contracts now. And really this year has just been our coming out party for growth. So please reach out if you have questions, if you're interested in knowing more. We have a lot to do. We're at a very exciting time, moving very quickly. Our CEO, Mark Wingertson, is here with us today. Feel free to reach out to him, myself. We also have our founder, Brianna Ronco-Stevens, and our Chief Scientific Officer on the line with us today as well. But Anna, I'll throw it back to you to start going through some questions.
Okay, great. Thanks, Sam. Talk a little bit about who are your customers.
Yeah, so the really beautiful thing about making these kinds of tests so accessible is our customers can have absolutely zero experience with RQAs in general, let alone developing them. So as I mentioned before, an example of maybe a nutritional company, a health company. It could be even outside of the sort of healthcare space, water testing companies that would never normally develop their own. Maybe they would go buy off the shelf ones, but now there's an opportunity to actually capture for them a part of the revenue that's coming from existing tests, and simply ask us, hey, I'd really like to be able to test for blank. And we say, great, we'll go make you an assay, we'll brand a Hue card for you, and you will sell them directly to your customers. So it really can be anyone. Our customers are everyone from existing labs to companies that have never addressed something like this before.
And so why is a quantitative rapid diagnostic needed over a qualitative diagnostic like a COVID test?
Yeah, so that's a great question. So qualitative tests, to sort of put simply, qualitative tests detect usually the presence of a chemical or an analyte, and they have limited usefulness. In a few cases, detecting the presence of an analyte, such as COVID-19, for example, accomplishes the product goal. However, if, for example, a glucometer, a diabetes glucometer, simply told you almost laughably whether glucose was just present in your blood or whether it was high or low, they would have far less utility. They would be nowhere near as useful. So measuring analytes with a high degree of quantitative precision and accuracy opens doors to what would be otherwise very, very high cost, very slow lab-based diagnostics. So we're really putting an entire lab onto a $5 device. So that's the importance of qualitative versus quantitative.
And who owns the data produced by your platform?
Yeah, so HueDx intends on being a platform to help you launch your products, your RQAs. So you own your data, all the data produced by your Hue cards. HueDx does not collect any sort of information from any of your users at all beyond what's necessary to just produce a result. So for example, if your users' sex is needed, for example, for blood-related diagnostics, that would be collected in order to produce a result. But we don't collect any data that isn't necessary for actually producing a quantitative result, and you own all of it.
Okay, thanks for that clarification. So Camille says, I had a hard time getting info from you on the web. Are you building a corporate website? How does she follow? And is she on social media?
Yes, so you can visit HueDx.com. You'll see most of everything that you saw here today with a few more details. We did launch this product just, a little over a month ago. It is new on the market. We are quite literally closing contracts as we speak. So there's not a wealth of information yet because it's so new, but you can visit us at HueDx.com.
Wonderful. And any plans to go public? Alan Klee wants to know, are you currently doing a raise?
We are currently doing a raise. We're about to sort of officially open that raise in May. It will be complemented by a public crowdfunding actually at the same time. So both accredited and non-accredited investors are encouraged to reach out and collect more information ahead of that round. We'll be officially opening that at the beginning of May.
And Kyle Burgess asks, how do you get to 4% market share? What percent do you currently have? And what's the growth plan to get you to your target 4%?
Yeah, great question. So the beauty of being quantitative across the board is we can actually approach companies who make existing rapid tests that are not quantitative, or they're slow, or they're not very quantitative, or they're really expensive. We can actually approach them. They're already selling tests and say, let us improve it for you. Adopt the Hue card. We can make them faster, we can make them cheaper, and we can make your measurements more effective and more quantitative, more statistically significant. So we can approach those companies that are already selling. So that's going to give us a market share of improving existing tests. Then there is the what I would call sort of the complementary test approach, which is companies that already have RQAs, or they have rapid tests that are not quantitative, and they simply want to add more. They want to develop more faster. And so we approach them and say, okay, your current sort of portfolio of tests includes, A, B, and C. We can add D, E, F, through the rest of the alphabet, and we can do it in about 10% of the time. So there's approaching those companies, expanding their portfolio. And then the last one is approaching those companies that I mentioned earlier that have never developed tests and would never normally intend to develop tests, and approaching them with an opportunity where we say, maybe you have a sort of data-centric health company or nutrition company or wellness company where your users would benefit dramatically from a maybe quarterly screening for some sort of disease or monthly diagnostic for maybe their gut health. And we approach them and say, we can do all this for you. All you have to do is tell us how to brand it and how many you want. And you can begin selling them as a complement to your existing product offering. So between those three sort of strategic pillars for capturing the market, we expect that to be both to create new markets from the latter of those three pillars, and also capture existing ones through companies who are already really good at selling tests. We just make them better.
Thank you for that. Sunny asks you to discuss any HIPAA hurdles that exist regarding your platform, and have you overcome them? Yes,
we've overcome them by actually collecting as little data as possible. So all we need to produce quantitative results for, I would say, 95% of all the assays we've ever identified is a picture of a Hue card. That's all that we need. You upload a picture of a Hue card, you get quantitative results back. We don't need to know who they are, where they are, what they're doing, how old they are, et cetera. And that's in the sort of medical side of things. Of course, it's not relevant for other types of industries, but for medical devices, we need no other kinds of information. So we store no other kinds of information, and therefore HIPAA actually isn't really relevant for us.
Thank you for that. So Justin Oliver says, for the development launch platform, who are the customers and how do you get paid? What's the revenue model and payment schedule? Is payment recurring? Can you break that down?
Yeah, absolutely. Actually, I have a handy slide here that breaks it down pretty simply. So this would be, what you're looking at here would be relevant for a company who would want to use our assay development tools. So there's a handful of tranches here. You can kind of break it down into software and hardware. So for the software component, to help those companies who want to develop their own assays and want to use our tools to do it, there's sort of two sections here. One, the development tools to create the assays that'll then be dropped into our Hue cards is totally free. There is then once you're ready to launch the actual assay as a product inside of the Hue card, we have a production API that gives you all the bells and whistles for doing everything from getting results from your devices to managing your devices, and all the other metadata and information you might possibly want for a fully fledged product integration. And that's just a simple pay-as-you-go model. There's a rate for making API calls. It's super simple. Then on the hardware side of things, that's also very simple. It's PO-based pay-as-you-go. Once you have your configured and branded Hue card with your specific assays that you're interested in, up to 6 unique ones on a single card, you just simply place orders with us. Place a PO, say I want 10,000 of these cards for my launch day. We go and make them, and you get them in a few weeks, and you're good to go. So you buy those directly. The only thing that isn't included here is the component of our service model for companies who don't want to develop the assay themselves, and we simply offer that as a service. The pricing for that is variable depending on the complexity of the assay, how many of them you want. But as far as I want to develop it myself, I just need your platform, very simple. Pay-as-you-go API, free development tools, and place POs for devices.
Great. Thank you for that, Sam. Mark Dean asks if you can talk a little bit about financials, talk about your balance sheet. Where are you with revenue the past 12 months, the next 12 months?
I prefer in such a public venue not discussing that, but very happy to share those details if you reach out directly to any of us on this slide, actually. Very happy to go through all of those. We are in the middle of an investment round, so those things are readily available, but yeah.
No problem. Does Mark also ask, does the company have debt?
Again, another thing I prefer not discussing in such a public forum, but very, very happy to go through those details in as much detail as possible with a direct link
Okay, great.
to the three of us. Yep.
Chris W. asks, does an end user use this through an app, and what is the cost? Yeah, so
sort of terminology clarification here, just to make sure we're all on the same page. I think this individual is identifying them correctly. So an end user would be actually the customer of our customer. So this is, an end user being me buying a HueCard through some nutrition company. It happens to be a HueCard. So it depends on the business model of our partner, of our customer. They may have a business model where there is a recurring monthly charge to use their service. If it's a sort of I keep bringing up this sort of nutritional company example. Maybe they sell some sort of customized nutritional supplement for you or something like that. Maybe they have a recurring business model where the end user ends up paying for access to a mobile app or a web application or something like that. It's totally up to them. We both have our own, as HueDx, we have our own mobile app platform that can be used by our customers if they don't want to develop their own mobile app. But we also have a very full-featured API that our customers can build into their own products. So it's actually up to them. It's not up to us.
Right. Thank you for that. Mm-hmm. Jim B says you talked about enterprise sales. So what's the difference between different types of customers, and why would each use your platform?
Yeah. So as I mentioned earlier, with those sort of three tranches, I want to develop the assay myself and take everything sort of full circle myself. Use HueDx development tools to develop the assay, integrate it into the HueCard, and then launch the HueCard as my product. Then there's I already make tests. I'm familiar with the space, but I want HueDx to develop the assay for me. And then the last being I've never touched anything like this. I want it to be totally a sort of white glove service, and I just want to sell HueCards for my product. The nature of those relationships are actually all very, very similar as far as we're concerned operationally. The process of developing an assay and integrating it into our HueCard is so automated for us at this point. It's so sort of the tooling we have built for ourselves to develop the tests that you guys saw in a previous slide. If I go up here, we built these tools that we're making access to our partners originally for ourselves to develop these tests. So the nature of those three kinds of relationships, to your question, is actually very similar for us. Because if they're developing the assay, they're using our tools. They say, this is what we want our HueCard to look like, and we make them their HueCards. Or if we're developing them ourselves, we're using the same tools that they would be using to get it done in a couple months. So as far as the nature of the relationships, they're all very similar, but one of them has an added little service of developing assays for them. So it's quite simple for us, actually.
Perfect. Andy wants to know if you have any majors in the space as joint venture partners or customers.
We do. I can't publicly announce those, but we do. Also happy to discuss those with a direct link.
Sure. Tom Lawrence asks, what valuation was your first raise done at, and what valuation are you raising funds at now?
Again, another one of those. Happy to discuss one-on-one.
Okay. Jim Frost says, you mentioned 8 patents. Can you talk about what they protect and talk about your competition, how your platform is different?
Yeah. So our IP strategy goes from, actually, this does a good job, actually, the IP strategic pillars of covering what the existing patents are addressing, as well as what the 5 patents we'll be filing this year cover. So there's overall utility. There's sort of the idea of having a platform that makes it easy to drop in arbitrary assays across many different industries. So there's that sort of umbrella protection. And then from that umbrella protection, we sort of break out each one of the components that make that the platform possible. So to make the platform possible, you have to be able to design the device itself. So there's patents for the design. You have to be able to manufacture them at volume, because these are rapid tests. They're disposable. So you need to be able to make them in the hundreds of thousands to millions. So we have IP in how to manufacture them. We also have it in the chemical side of things. So our entire R&D department has built over the course of years these strategies for developing chemical assays. So we have protections on that front, on the sort of biochem side of things. And then we also have what does the sort of heavy lifting in the cloud, all of our software algorithms, so that you can quite literally, and I have done this, take photos of these Hue cards under a desk, on a kitchen table, in a lab, in a field, in the grass, on a cloudy day, on a sunny day, so that these truly are sort of accessible. So that's been our sort of strategy: umbrella protection, and then focus in on all the components that enable the platform.
Perfect.
I think there was another component to that question.
Yeah, so talking about your competition, how your platform is
right.
different, and aside from the cost aspect that you brought up, how else are you different?
Right. Yeah. So I think we don't have any direct competitors. There are many companies that already manufacture rapid tests. I think the difference is that all of those other companies, to our knowledge, every single one of them went through this process, whether or not FDA was involved or not. They went through at least these 6 steps. It took them 2 to 4.5 years, assuming that we're talking about a company that can make RQAs. If they wanted to make another one, if they wanted to add another product to their slate, another product, they would go through this process again. Maybe they're a little bit better because they made 3 or 4. Maybe it takes them 3 years. Maybe it takes them 2 years or a year and a half if they're really, really good. The big difference is we can do that in 3 months. In some cases, we can do it in even less, depending on how easy it is to make the assays. So we're truly a platform to scale and add new tests. I think traditionally, biotech, pharmaceutical companies have not focused on the software side of things. They've focused on the chemical side of things and the physical device. They have not focused on making this scalable and repeatable. Traditionally, biotech companies are just not good at the software side of things. Our software and our sort of arbitrariness of the platform enables us to be tremendously agile and fast from napkin sketch to product launch. And that really differentiates us from everything from the startup side of things all the way up to the big pharma side of things. No one's really doing it that way.
Wonderful. Well, Sam, this is fascinating stuff. Thank you so much for joining us on our conference. Please come back with some updates. We really look forward to hearing your progress.
Yeah, thank you guys very much. I appreciate you taking the time. Please feel free to reach out to us. I'll slap that slide up there one more time. But thank you very much, Anna.
All right. Thank you so much. Okay, everyone, stay with us. We'll be right back with our next presenter.